I'm going to show you how to perform a skin puncture to draw blood. And remember that when we stick the patient, we want to stick either the middle finger or the ring finger. We call that the third and fourth digit of either the left or the right arm. Okay, so or the left or the right hand. And so I'm going to go ahead and stick this middle finger of your left arm. Okay, so what I would do is I would actually have the patient warm up their finger for 5 minutes on the clock. So for 5 minutes on the clock, we're going to wrap the finger up and warm it up. Now, what happens when we warm up a finger for 5 minutes? Well, the capillaries in the blood will start to dilate. They'll start to become larger. So that when we stick, those capillaries are going to be very generous and give us a lot of blood. And sometimes you can see where we need a lot of blood. Okay? So how long do we leave this on before we stick?
5 minutes.
5 minutes. 5 minutes on the clock.
On the clock.
Remember, it's not what you thought was 5 minutes or what felt like 5 minutes, but I want you to go for 5 minutes on the clock. So if you start now, that'll be 47 after that you have to, you have to wait till 47 after. Okay. So this is just a glove that we put water in. We tied it off like a water balloon, and then we put it in the microwave for 1 minute. Okay. So this goes in the microwave for 1 minute, and then it goes wrapped around the finger for 5 minutes. Okay. That's to warm up the finger so that we get good blood flow. All right, now for this procedure, you're going to need a lancet, and if I pull this off, you'll see the platform with a little hole. Do you see a little tiny hole in there? That's where the spring-loaded needle is going to come out. Okay, so make sure you keep that as clean as possible. We're also going to need a spot Band-Aid so that we put a Band-Aid on the puncture site when we're done. Okay, we're going to start off by filling up what's called a hematocrit tube. Hematocrit tubes look like this, and I want you guys to understand that this is a glass tube, and anytime you have a glass tube, what do you have to worry about happening?
Breakage.
It breaks. Now remember, when glass breaks, it becomes a sharp object. And a sharp object with blood could stick you, could cut you, and then put blood inside of you. The patient's blood now goes inside of you, and you don't want to do that. So you really have to handle these with care. I'm going to go ahead and get 3 cotton balls. There's 1, 2, and we'll get a third one. And we'll place that on top, and we're ready to go. Now remember, before you begin, always introduce yourself. Explain to the patient what you're going to do, get consent, and then also ask the patient to spell their first and last name for you along with giving you their date of birth. Okay? We need to make sure we are 100% sure that we have the right patient. Right? Not 99%, but 100% sure. Now, once the patient has given us consent, we've identified the patient, the next thing we're going to do is check for allergies. Is the patient allergic to cotton? Some people are allergic to cotton, alcohol, or maybe the metal in the needle or the adhesive on the Band-Aid. We need to make sure that they're not allergic to these items before we actually use them on the patient. Okay? So do you have any allergies too? No. Okay. I'm going to go ahead and put the glove on. And I'm going to try to make sure that I put the glove on, but that I keep it as free from contamination as possible. Now, notice how I'm just trying to be very careful not to touch with my hand the outside of each glove, or that I don't allow the gloves to touch my arms. Also, don't scratch your head. Don't touch, definitely don't touch the sharps container or that trash receptacle. Just keep your hands clean for the sake of the patient, all right? The first thing I'm going to do is I'm going to decide which finger I'm going to stick, and I'm going to go ahead and stick this middle finger. So here's what I want you guys to think about. Even when you're at home watching this video, I want you to think about how we're going to hold the finger. You're going to take 2 fingers. Maybe you guys might want to practice those on each other. Take 2 fingers, so go ahead and practice on each other. Take 2 fingers on each other. And you're going to, yeah. Let me just keep it, we'll do it afterward. Okay, so we're going to take 2 fingers, and we're going to wrap it around the finger like this. And I'm going to create a U shape. A U shape. And then I'm going to take my thumb and place it on her fingernail, and I'm going to be squeezing the finger like this. Now notice how the finger turns bright red. Okay? That's what I want you to do. Also, if you'll notice, there's no gap between my thumb and that finger and my thumb and this finger. I've created a full circle around her finger. Essentially, I'm choking off the finger. So when I poke the skin and I squeeze, the blood only comes out. It doesn't slip back into the finger. Okay? So now that I have this grip, I'm ready to go. Please don't grip like this. People tend to want to do this. That is not the correct grip. You're going to have a hard time with this procedure. Let me do this again. You're going to take 2 fingers, wrap it around, and then bring your thumb in the back and join the fingers to your thumb so you have a full encircling squeeze. Okay, so now I'm going to take my first cotton ball, I'm going to get some alcohol, and I'm just going to prep the skin from small to larger circles. Okay, is that wet? Did that feel wet? Yeah. Okay, okay, now we're going to give that 30 seconds to dry. 30 seconds on the clock to let it dry. Okay, and once that's dried, we're going to take the lancet, take the cap off, throw it over here in the trash. Notice how I keep throwing my trash in there. And we're going to position that little hole where? Where do we? The lateral aspect of the pad of the finger, all right? So we're going to position that hole right here to the lateral aspect of the pad of the finger. Remember, not at the tip of the finger, not at the side of the finger, and not on the pad of the finger. We're going to the lateral aspect of the pad of the finger. Notice that little platform, that blue platform? That's what I'm actually going to press into the skin, all right? So, ma'am, you're going to feel a stick in 1, 2, and 3, but I'm going to grip just before I stick, all right? So here we go. 1, 2, 3, grip tight, push hard, and then throw it in the sharps. You'll notice that you get this, a little drop of blood, and we're going to just take that drop of blood and we're going to wipe off the first drop and throw that in the trash. Then I'm going to take my tube and hold it from upside down. I'm going to take my tube and I'm just going to place the opening of the tube right to that drop of blood. Okay? Now notice how I squeeze, draw the blood in, and then I relax. And then I squeeze, draw the blood in, and then I relax. I get into this rhythm of squeeze, draw the blood in, and then I relax. Now, why am I relaxing? Squeeze, draw the blood in, and then relax. I'm relaxing because I need to give the finger a chance to fill up with blood again. So I squeeze the blood out, I relax, let the finger draw the blood back into it, and then I squeeze again. And so I get into this rhythm of squeeze, relax, squeeze, relax. See how it pinks up? When I squeeze, the finger turns white. See how it's white and then it pinks up? That documents for me that the finger is filling up with blood again. Okay, so squeeze, relax, squeeze firmly, relax, squeeze. There's a technique to this. Does that hurt? No. No. So I know sometimes you guys will feel like, oh my gosh, I don't want to squeeze too hard because I'm going to hurt them. It doesn't hurt. Now, we didn't leave the warmer on your finger for 5 minutes. That's when you decided you want to go to the other hand. And so it's not really bleeding that good. But if it stops bleeding because it clots off, then what you're going to do is you're going to set this down, prep the skin again, stick them again, and then finish filling it up. I think it's starting to stop bleeding. At any rate, what you're going to do is you're going to have the patient hold that, and then you're going to set this down. Now, with your dirty hands, you cannot touch any of your supplies, okay? So what I would like for maybe you to do is open that lid and put 2 more cotton balls here. No, you go ahead. Yeah, just 1, 2. And then, actually a 3rd one. And then if you'll get me another lancet, open that up. No, they're down in here, in the top drawer. Another one of those lancets. And then, so what I'm going to do is I'm actually going to stick again to finish filling it up, right? So what I'm going to do is I'm going to take my alcohol, and can I get your other hand? Sorry. And I'm going to just go ahead and prep this one, let it dry for 30 seconds. And I'm going to stick that hand and I'm going to finish filling this up. It's not uncommon that you have to stick a patient more than once for this procedure. This is why it's real important that you warm up the finger for 5 minutes. Okay, so now that 30 seconds are gone, I'm going to wrap my finger around, joining my fingers to my thumb. I'm going to position this to the lateral aspect of the pad of the finger, squeeze tight and warm the patient. Ma'am, you're going to feel a stick, squeeze tight, push hard, throw that in there, wipe your first drop. And now I can go ahead and continue filling this up. Okay, so we'll give you this last little pressure there. Okay, notice how I never tilted this back. In other words, I never tilted it like this to where it was tilted. I kept it horizontal the entire time. If you tilt it, because both ends are open, the blood's going to shift to the back end, and that's not good. Okay? Did you notice how I kind of stopped short of that red band? Okay, look at how much I stopped short of the red band. There's an important reason for that. Because what I'm going to do next is I'm going to actually hold this with 2 fingers and then seal off the back end with the 3rd finger. Now remember, this is glass and it can break. Right? Let me do this again. I'm going to hold, with my thumb and middle finger, I'm going to hold the center, and then with my index finger, I'm going to actually seal off the back end. That will allow me to stand it up without the blood dripping out. Okay? Now I know you guys have all fed water to a baby with a straw. Have you done that, where you stick the straw in the cup, you seal off the back end, and then you take the straw to the baby's mouth, and then you let off your finger right and the water drops in the baby's mouth. The same thing happens here. In order to stand this up, we're going to have to seal it off at the back. Now be careful not to break the tube. And we're going to take this clay tray, put it right in front of us, and we're going to actually press the tube straight into the clay tray till it hits the bottom inside, all the way to the bottom. And then we're going to twist it and then lift it up. Now you'll notice that it's actually to the red band. Now I know that doesn't look like it's to the red band, but if you'll notice there's plasma on the top. That's her plasma. And the plasma actually landed on the red band. And the idea is that you want to fill these up all the way to the red band. Okay? So this is what you're going to show me. You're going to hold it up like this with the red band on the top. You're going to say, I think I got a good one. And that's what I would consider to be a successful stick for the skin puncture. All right, don't show it to me like this because I can't see anything. You have to hold it like this with the red band at the top. And that's what I'm looking at. Please remember that when you seal it off, you have to push it straight down until it hits the bottom inside of this, the tray, and then twist it and then lift it up. Also, do not forget that these break very easily. You can't handle them rough. You have to be very delicate with these tubes. Okay? So